I'm Dr. David, and this is News You Can Use. Today I want to talk to you about probiotics, prebiotics, and leaky gut syndrome. But first, I want to read you a little bit about some research recently published in the Journal of the National Cancer Institute. Now, this is one of the largest epidemiological studies of human gut bacteria and colorectal cancer ever conducted. And it shows that a decreased diversity of bacteria in the gut is associated with colorectal cancer. Now, that's one of the up-and-coming cancers and one of the big killers out there. This is one of the ones we've got to look out for. It's a lining tissue cancer. This work was done out of the New York University School of Medicine. And what they showed was that in cancer patients compared to a regular patient population, in cancer patients, not only did they have fewer good bacteria, but the number of strains of good bacteria was different. In the cancer patients, they had many, many fewer strains. In the healthy patients, they had more of the positive strains. Gut bacteria is really, really important. 2/3 of your body's detoxification system is located in the gut. We used to say half the body's immune system is located in the gut. Not anymore. We're up to 60% now. 60% of your immune system is in your intestines. That's really, really important. The intestines are so important, some psychiatrists are calling the gut the second brain because it secretes more brain hormones, more neural hormones than the brain. But that's not our subject. I want to talk to you a little bit about leaky gut, probiotics, and prebiotics. Prebiotics prepare the gut and provide food for the good guys. Probiotics are the good guys. I like to use a product called iFlora because not only does it contain billions of active bacteria, but even more important, it contains 16 strains of the good guys. Now, there are all the 50 different strains of good guys found in the gut, but we've been able to isolate a number of them. Some of the better probiotics have 10, 11, 12 different strains. The poorer probiotics have 3 or 4. iFlora has 16 different strains. At the root of all allergy sensitivity, according to the latest research, we have a condition called leaky gut syndrome. And leaky gut is exactly what it says. It lets stuff in through the lining of the intestines into your bloodstream that doesn't belong there. The body takes a look at it and says, it doesn't belong here. And it builds antibodies. Now you've got a reaction. So what we want is to stop leaky gut syndrome, bring the gut back to health. And the primary way we do that is correcting the diet, eliminate the sugars, okay? Eliminate the simple carbohydrates in the diet and replace the probiotics. In the cases where people do not have permanent damage to their gut, that fixes them. For most children, this fixes them. For adults, it doesn't. Does it happen quickly? No, it doesn't. It takes time. Probiotics are important. They lower your colorectal cancer risk. Probiotics are important. They stabilize 60% of your immune system. Probiotics are important. They stabilize 65% easily of your body's detox system. Don't be afraid to take probiotics on an ongoing basis. Don't be afraid to eat fermented foods. I take probiotics every day. All of my patients have leaky guts because I deal with allergy on a daily basis. So all of my patients take probiotics. You probably should consider that as well.